Hello, my name is Sophia Gogin, and for me, the most interesting aspect of becoming a sonographer is the application of non-invasive imaging technology on patients in a dimly lit, hush environment. I'm intrigued by this unique atmosphere. I'm intrigued on how the transducer is able to display images through mechanisms of applied physics, but without the use of radiation. I'm intrigued by the idea of understanding an image that looks very structured to the trained eye, but like complete chaos to someone else. Many times over the past couple of years, I've assisted my mom as an interpreter in various clinical and hospital settings. During a vascular ultrasound appointment, I was able to witness the work of a sonographer. I was able to see that when the sonographer came in the room, though they were not having a lengthened conversation with my mother, they were still able to direct my mom to a comfortable position for the necessary treatment. This experience showed me that the absence of verbal communication was not a show of incompetent care. This experience showed me that you can communicate so much while saying so little. My employment experience as a certified nursing assistant at Providence Regional Medical Center was able to prepare me for a very rigorous and fast-paced environment. During my 3-month summer course, I was able to learn my skills by getting my siblings to play as my patients. Even though I had been taught a variety of skills, for clinicals, the work environment expected much more out of me. Since I worked on the orthopedic floor, I had to learn how to drain abscesses as well as how to move patients with hip fractures. However, I was not scared to continuously ask questions because I did not want to be in a situation where I did not know what to do when I was in front of a patient. There was a time when a nurse had asked me to grab a specific item out of the room because they were in a COVID patient's room and I was not able to do the said task. Because of this struggle, I spent my time getting familiar in the equipment room so that that situation could not repeat itself. Since I worked 12-hour overnight shifts, my schedule didn't really allow for much free time, and so I had to learn how to delegate my priorities. As a CNA, my care primarily revolved around sick and dying patients. A patient that changed my view on patient care was a bedridden individual who suffered immense mental illness. This patient was often anxious and agitated, which made him very difficult to feed and take care of. Due to his condition, he was often very hungry and needed specific snacks, and so he didn't get much attention outside of essential care. So I decided to be patient with him. I decided to spend a little extra time getting to know him and provided him with the attention that he desperately craved. This decision calmed his agitation and eased the chaotic environment of the night. I learned that just by propping someone up with a warm blanket, bringing them a cup of water, bringing them a hot pad, I could transform the most difficult nights of my patients' lives to be a little bit more bearable. I learned that small acts of compassion and care can bring light into a very dark, painful, and hopeless situation. I learned to show that I truly care by putting myself in my patient's shoes. Although I can't always imagine what they are experiencing, I can empathize with their pain, I can empathize with their discomfort, and I can empathize with their helplessness. There are 3 main types of sonography specialties. The first is general sonography, and it involves the imaging of various internal organs and structures. These vary from areas within the abdomen and pelvis regions, such as the kidney and livers, to subparts such as the thyroid. General sonographers assist in diagnosing conditions such as gallstones and tumors to conditions related to reproductive health. When people hear the word ultrasound, they immediately think of baby scans, and rightly so, because this specialty incorporates the practice of monitoring fetal development. In contrast to the cardiac and vascular specialties, general sonographers deal with a wide age demographic and increased outpatient care. Echocardiography, also known as cardiac sonography, focuses on imaging the heart in order to display functionality within its chambers. The atriums, ventricles, and valves are all analyzed, ensuring proper function and regular blood flow. Observed irregularities and malfunctions assist echocardiographers in proper diagnosis of various cardiac conditions such as congenital heart defects and heart murmurs. Finally, the third type of sonography is vascular sonography, which involves the imaging of blood vessels in the circulatory system. Sonographers evaluate blood flow, detect abnormalities and blockages, and help diagnose vascular diseases. Each of these specialties requires specialized training and expertise. For instance, vascular and echocardiography also use additional technology like high-frequency transducers and Doppler imaging. Ultimately, these specialties work closely with physicians and other healthcare professionals to better provide clear diagnostic imaging to assist the patient in their next steps. Out of these three modalities, I would choose to go into the cardiac specialty. Cardiac ultrasound offers the opportunity to focus into one specific area of expertise within medical imaging, which will be providing me with in-depth understanding and proficiency in diagnosing and monitoring cardiovascular conditions. I want to be able to take a functional assessment of the heart. The first time I saw Wicker's heart diagram, I was immediately intrigued on how the pressure and volume in the heart chambers cause the lub-dub sound that we hear. More than ever, I want to be able to finally share my enthusiasm with others. I am a re-applicant to the program this year, and I have spent my time focusing on others in the past year. Though I no longer work at Providence, I have continued my love of serving with my passion for coffee and have been working as a barista and have opened up a coffee space within my home church. Healthcare is essentially about promoting patients' physical, mental, and emotional well-being, and that is exactly what I have been doing over this past year. It has been able to teach me greater love for others, and after all, it is all about human connection. To wrap up, I believe that the greatest challenges I would be facing would be to learn how to deal with a broad scope of patient body types. I understand it may be harder to obtain high-resolution images if the probe is not positioned correctly. I would need to learn how to optimize scanning techniques while still maintaining proper ergonomic positioning, another of the challenges I would be facing. My medical expertise has been able to teach me how important it is to keep my body aligned when putting a patient's weight on myself. Even my barista training has allowed me to keep in mind how much of my wrist I use while pulling shots. Taking care of myself is how I will be able to take care of others more proficiently. Thank you.